1/3 of all visits to primary care doctors involve reassurance, meaning there's nothing wrong with the person. And if you understand that 1/3 of all visits, simply the person wants the doctor or clinician to hear their issue and reassure them that this is not something they should be concerned about. So I know I get that all the time where friends literally will call me and say, hey, my wife has a swollen ankle or a swollen knee because she was, playing volleyball, but, it's getting worse and it's getting red. What should I do? So a lot of times, you can get that sort of medical insight through a telemedicine call, a phone call, or potentially going down to your primary care offices if they can see you that quickly. So I'm hoping a lot of the changes that COVID kind of forced upon us will be positive changes that will allow people easier access to healthcare for very routine kind of stuff, literally by opening up an app on your phone or getting on your computer. The technology has evolved that you can go to a clinic where the doctor is not there and they have a stethoscope that goes through the computer and the nurse or whoever can put it on your chest and they can hear your heart sounds or see in your eyes and ears. So that technology exists. I'm not sure that's for telemedicine at home, but that's for telemedicine where you go to a location where there's no doctor. And so that doctor can have sort of like do a quasi-physical on you. There was a device that was just came out with that literally is an ophthalmoscope, otoscope, and I think a stethoscope all in one. That's the information is communicated through the cloud to a doctor waiting somewhere else. So I think the technology is evolving. Even in ICU medicine, not to change subjects, but there are several ICUs in the country where the ICU doctor is remote and looks at all the vital signs and stuff from the machines that keep people on life support, and they get all that feedback through a computer. Because a lot of treating people on life support is really the data you're getting from all the machines, and with the nurses sort of filling in and giving you the information in between. So to go back, and if you think about it, if 1/3 of visits are about reassurance, if you accept that number, that probably means 1/3 of visits could probably be handled for the most part. And remember, with telemedicine, they also have the ability to send you in for blood work or to say, that looks a little more serious. Maybe you should come to the office. So it's not like a light switch where it says telemedicine or not telemedicine. You can combine that telemedicine with laboratory testing, with, coming in, if it really gets to the next level. So, but yeah, in certain cases, you just have to have someone physically see you. But there was an old adage. I remember when I was in medical school, I had an older gentleman, tell me they could make the diagnosis of a patient by hearing their story, meaning that, whatever story that the medical residents or students told them, and walking into the room. They said, just like I could walk into the room and almost tell you what the diagnosis was, because, people who are super sick have a certain look. And of course, you don't want to go based on that alone. But I think this is sort of the art of medicine where, hearing the patient's story, understanding the history and the sequence of events, whether the symptoms have been there before, how long, does it, pain radiate anywhere, what other symptoms do you have associated with that? When you really, what doctors really do, and now that I've been doing it for I still do a physical exam when I see a patient, but really that's always, for the most part, to confirm my diagnosis that I already have in my brain. Rarely will my physical exam change my diagnosis. It can, but 9 out of 10 times, what I'm thinking when the person is talking to me is what we find when we, examine the patient, do the laboratory testing, do the ultrasound. Sometimes you're surprised, but again, for the vast majority of it, the history, the details, the patient's past medical history, their social history, their surgical history, all tell a story. And if you've been doing it for a very long time, you can actually put the puzzle together. So I think that's where telemedicine comes in. If you're a seasoned clinician, hopefully you will know when to say, oh yeah, I think with a fair degree of certainty, I think this is the diagnosis. And you'll also hopefully be seasoned enough to say, wait a minute, I think I need to see you, or you need to go to the ER, or you need to go to the urgent care.